Good morning. My name is Brenda Gray. I'm here to perform a physical assessment on my patient. His name is DG. And as he was coming into the room, I assess for any gross abnormalities, any acute distress. I will start with vital signs. So I'm going to check your temperature. Okay, I'm going to go ahead and put this pulse ox on your finger while I'm checking your blood pressure. It's okay, just move it around. Okay. 118/78. Okay, I'm going to check the pulse here. Pulse ox is 98. Pulse rate 74. And I'm going to be, through the entire physical assessment, I will be inspecting the skin as I go through, checking for the temperature, pulsating, checking for any edema, for the skin color, and if there are any lesions or anything going on. And initially, I'm going to assess the orientation, which is a Glasgow Coma scale, for person, place, time, and situation. I'm going to check his effect, and I'm going to start with trigeminal nerve, which is cranial nerve number 5. And I ask the patient if you will clench your teeth, okay, and I assess for any muscle atrophy. And then I'm going to ask you to close your eyes, and I will assess going down the face, starting at the forehead, then the cheek, and then the chin. And he's going to let me know if it's dull or sharp.
Dull, dull, dull.
Okay.
Sharp, sharp.
Okay, now this side.
Dull, dull, dull.
And sharp. Okay, and then I'm going to assess for cranial nerve number 7, and that is the facial nerve. I'm going to ask you to make faces, so if you will smile and crinkle your forehead, grimace for me, pucker, okay, okay, and then cranial nerve number 9 is the vagus nerve, and I'm going to check for gag reflex, so then I would of course use a tongue blade and check the gag reflex and make sure that his swallowing is okay. And then cranial nerve number 10, which is the glossopharyngeal, is to assess whether he can tell the difference between bitterness or sourness on his tongue. And then cranial nerve number 12, which is the hypoglossal, is the movement of his tongue. So if you will open your mouth, let me check your tongue, move your tongue in and out, move it sideways. Okay, okay. So now I'm going to assess the scalp and the hair. his head, make sure there's no nodules going on. I'm going to assess the external eyes and for any redness or any drainage or any out of proportion going on with it. I'm going to assess his visual acuity, and we will do that with the Snellen chart 20 feet away, and then also we have the Rosenbaum chart, which he would hold at arm distance and then read for me. And then I'm going to check for cranial nerves number 3, 4, and 6, which are the trochlear and the abducens and the cranial nerves. And I would like you to watch my fingers. Okay, that's the 6 cardinal films. And then I'm going to check for his corneal reflex. I'm going to shine this in the middle, and I want you to look out to a distance. Okay. Okay. So that was checking cranial nerves number 3, 4, and 6, which was the oculomotor, the trochlear, and the abducens. Okay, so I can also check for sinuses while I'm here, see if there's any tenderness. And as we go through the assessment, I assess his hearing as we communicate with each other. I can go ahead and assess the external part of his ears. I can assess his nose. And if you will open your mouth for me, I'm going to assess inside of his mouth, mucous membranes. I'm going to check his tonsils, his teeth, his tongue to see if there's any nodules or any problems going on there. And I'm going to go ahead and assess his trachea and make sure that it's midline. Okay. And then I will move down to the thoracic region. I'm going to assess and make sure that it's in symmetry. I'm going to assess for breathing. I'm going to look at it anterior, posterior, and laterally. And I'm going to palpate, make sure there's no tenderness, no nodules, no crepitus going on in the thoracic region. Okay. And I'm going to listen to breath sounds. And I'll listen for one full breath, and you can just breathe normal. Okay, now I'm going to auscultate the posterior. Okay, so now I'm going to check for thoracic expansion. If you could take a breath for me. Okay, I'm checking symmetry there as we're going on. So now I'm going to start with the cardiovascular by palpating each carotid. I will then assess his brachial pulse and his radial pulse bilaterally. I will check his femoral pulse bilaterally, and then his popliteal. I will assess his dorsalis pedis pulse bilaterally, and his posterior tibia pulse. Okay, so now I'm going to listen to heart sounds. I will do this with the diaphragm and the bell. So I'm going to listen to the aortic, the pulmonic, or pulmonic, Erb's point, the tricuspid, and the mitral. And then I will listen with the bell. And listen to the heart sounds, the aortic, the pulmonic, Erb's point, tricuspid, and the mitral. And I will go ahead and listen to the carotid, for any brutes. Okay, and I'd like for you to lay down for me. And I'm going to listen to the heart sounds again while the patient is lying down. First, I'm going to have him at 45 degrees, and I'm going to assess the jugular distension. And then I'm going to listen to his heart sounds while he's lying down and check the difference. So I'm going to check the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral. And then I'm going to do that again with the bell. Okay, so now I'm going to move to the abdomen. I'm going to check for distension, and I'm going to assess it for any pulsations that might be going on, the contour of it, and then I will start with auscultating. And I will start in the right lower quadrant, checking for bowel sounds. And then I'll move to the right upper quadrant. And then the left upper quadrant. And then the lower left quadrant. Okay. So now I'm going to palpate the abdomen, and I will do it lightly for any tenderness, and then I'll do it deeply and check, see if there's anything abnormal, any pain, or any masses going on. Okay, and so then I'm going to have you to come back and sit back up, or you can sit right there on the couch, whichever you prefer. And what I'm going to do now is I'm going to check the musculoskeletal system. And I will do that with starting with the neck, the range of motion. So if you will look down for me and then look up, turn side to side. Okay, good range of motion. Then I'm going to check his neck strength. So if you will pull against my hand this way, okay, and then this way. Okay, and then I want you to roll your shoulders, checking the range of motion forward and backward of the shoulders, okay. Move your elbows, okay, and then move your wrist up and back, okay, checking the range of motion. I want you to raise your arms up like this and then pull against me, okay, checking for strength. I want you to raise your knees up. And we're checking for range of motion of the hips, and then bend, range of motion with the knees. And then we're checking range of motion with the ankles. So move your ankles for me. Any tenderness, all of its range of motion. Okay, so then we're going to check the strength, so of your knees, okay. Push and pulls, normally laying down with the feet, laying down. So now, if you will sit up here, I'm going to check some reflexes. Okay, And also with the muscles, I checked as he was coming in, his gait, and just, you know, how well he walks. I'm looking at the muscles for symmetry, and if there's any atrophy or anything going on. So I'm going to check the brachial reflex bilaterally. I'm going to secure. Okay, so then I'm going to check his knees bilaterally, and then I'm going to check the clonus, and I'm going to support his leg, and then I'm going to flex his foot. Okay, and that is the end of my head to toe assessment. And as I went through my assessment, I did assess the skin. As I go through and do the range of motion, you know, I always assess for if there's any edema or any problems with the skin. Okay, thank you.